Blisters. Blisters are the painful, and common, result of ill-fitting footwear. At the first sign of discomfort, remove boots and socks and place a piece of adhesive tape over the affected area. If it is absolutely necessary, open a blister by first washing the area thoroughly, then inserting a sterilized needle into the side of the blister. Apply disinfectant and a bandage. Headaches. Headaches are often experienced in the mountains due to inadequate eye protection, tension in the neck, constipation or water intoxication, a swelling of the brain tissue which happens when the hiker has sweated excessively over a period of days and consumed large quantities of water without taking salt tablets. Aspirin may be used to alleviate the pain, but one should find the source of headache to prevent further discomfort. Snake bites. One species of venomous snake, a brown, is found in many parts of Australia. If you come across a snake, slowly ease back. A snake bite rarely causes death. Victims may be left untreated for up to 8 hours, but not in all cases. Some bite will kill. After an attack occurs, 1. Keep the person calm, reassuring them that bites can be effectively treated in an emergency room. Restrict movement, and keep the affected area just below heart level to reduce the flow of venom. 2. Remove any rings or constricting items because the affected area may swell. Create a loose splint to help restrict movement of the area. 3. If the area of the bite begins to swell and change color, the snake was probably poisonous. 4. Monitor the person's vital signs: temperature, pulse, rate of breathing, blood pressure. If there are signs of shock, such as paleness, lay the victim flat, raise the feet about a foot, and cover the victim with a blanket. 5. Get medical help immediately. Bee stings. Bee stings are common and harmless unless you are allergic. Remove the stinger, then apply disinfectant and clod water to reduce the swelling. A change of diet, dirty cooking utensils, or the consumption of tainted water may result in diarrhea, which in turn will cause a loss of nutrients and precious body fluids. Take extra care in cleanliness and boil water for an additional 3 to 5 minutes to avoid diarrhea. Hypothermia. When the temperature of your body falls to a level at which your vital organs can no longer function, you are experiencing hypothermia or exposure sickness. Hypothermia will develop rapidly and is caused by cold, wet or windy weather that chills the body at a speed faster than it can produce heat. A lack of energy, producing food and proper clothing will heighten the speed at which hypothermia will affect you. Always remember to bring extra clothing. It is important to hike at the speed of the slowest member of your party. Take frequent breaks and keep a close watch for members experiencing signs of fatigue. Exposure sickness generally occurs in temperatures of less than 10 C, 50 F. Symptoms are easily recognizable. 1. Feeling cold and constantly exercising to keep warm. 2. Uncontrollable shivering and numbness. 3. Violent shivers. Your mind becomes slow and starts to wander. 4. Violent shivering ceases and muscles begin to stiffen and become uncoordinated. Exposed skin becomes blue and thoughts are foggy. Victim usually lacks the capability of realizing how serious the situation is. 5. Pulse and respiration slows. 6. Victim will not respond and becomes unconscious. 7. The section of the brain controlling the heart and lungs ceases functioning. Treatment must be quick and efficient. 1. Move the victim to a sheltered area, out of the elements. 2. Remove wet clothing and replace with dry clothes and, if possible, a sleeping bag. 3. Wrap warm rocks and place them near the patient. 4. Do not let the victim fall unconscious. 5. Give the victim a warm, non-alcoholic drink. 6. Allow another person in the sleeping bag to share body heat. 7. Exhale warm air near the vicinity of the patient's mouth and nose. Hyperthermia. Hyperthermia is a result of the body being overheated due to increased air temperature, solar or reflected radiation, poorly ventilated clothing, a low fitness level or excess bulk. Symptoms include: 1. Heat cramps may occur and should be treated by moving the victim to a shady area and supplying water and salt tablets. 2. Heat exhaustion is a mild form of hyperthermia and includes symptoms such as headache, dizziness, fainting, clammy skin, blurred vision, nausea and vomiting. Treatment is the same as heat cramps. 3. Heat stroke is the most serious degree of hyperthermia. The victim will have little or no perspiration, a hot and flushed face, full pulse, and become either apathetic or aggressive. Cool the victim as quickly as possible, paying extra attention to the head, neck and chest. If the body's temperature continues to raise, unconsciousness, delirium, convulsions and ultimately death may occur. To avoid hyperthermia, avoid strenuous activity on hot days, wear loose clothing and a hat, drink plenty of fluids and take salt tablets. This concludes Elite Survival Training Australia's overview series. We have enjoyed putting this together for you and hope you enjoyed not having to read and getting so much information in 4 installments. We will show many how-tos and break down a lot of this information over the next few months. We would like to thank you for supporting us on this journey. You're an important and valued member of Elite Survival Training Australia. We are often copied but never duplicated. Here's to you. The ones that make this worthwhile. Lastly, it was my pleasure delivering this information to you, and stay tuned for some great how-tos with Premo Survivalist shortly when he recovers from hospital. As we say at Learn, practice, prepare and prosper. Take care.